Your time starts now.
Hello, Mr. Allen. My name is Dr. Sumera. Please tell me how may I help you today?
Doctor, actually, the nurse told me that my blood pressures are so high, and I recently got a report. Can I show you?
Yes, Mrs. Allen. Please show me your report.
Yes, it's Mr. Allen. Potassium is 5.8.
Potassium is 5.8. Okay. Any other report you have?
No, doctor, only this.
Okay. So, Mr. Allen, you have checked your blood pressure. What is the reading of your blood pressure now?
Doctor, the nurse told me it's 140 by 90.
140 by 90. Okay. Right. So, Mr. Allen, please tell me that do you have diagnosed high blood pressure, or this is the first reading you have today?
No, doctor, I have diagnosed since 10 years now. I'm taking so many medications.
Sorry to know about it. Okay. Please tell me that do you have any chest pain right now?
No, doctor.
Any shortness of breath?
No, doctor.
Any blurring in the vision?
No, doctor.
Okay. Any frothing in the urine?
No, doctor.
Okay. Please tell me that you are saying that you have blood pressure since last 10 years. So which medication you are taking for it?
Doctor, I'm taking this Ramipril and indapamide.
Right. So you are taking it regularly.
Yes, doctor.
Okay, right, good. Please tell me that do you are you following with your doctor with it with this you're taking this medication, so are you following with with your doctor?
Yes, doctor, I'm on a regular follow-up.
Right. Okay. Please tell me, do you have any other long-standing illness?
No, doctor.
Are you taking any other medications beside Ramipril and Indapamide?
Yes, doctor, these days I have some back pain, so I'm taking Brufen. Sometimes I take it's a gel, sometimes I'm taking 2 to 3 medication tablets.
Okay. So tell me, do you have any burning in your tummy?
No, doctor.
Right. In your family, does anyone has the high blood pressure?
Yes, doctor, my mom and dad both had high blood pressures.
Okay, so now how are they doing?
And they are on medications, but my dad actually, he couldn't survive heart attack.
Oh, sorry to know about it. Okay, so Mr. Ellen, tell me that what do you do for your living?
Doctor, I don't do anything. Stay at home. My kid is taking care of me.
Okay, and do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Okay, so do you do daily exercise? Any exercise?
No, doctor. Since my back pain, I'm not doing anything else.
I can. Sorry to know about your back pain. I can understand that it must be very difficult for you. And okay, tell me, what is your daily dietary routine?
I'm trying to take balanced diet, but doctor, I'm losing my appetite.
Okay, so have you lost any weight?
I guess 2 to 3 kgs in last 3 years. Oh, three
Okay,
months.
3 months. Okay,
Yes.
and you are saying you have back pain also.
Yes, doctor.
Do you have any problem in your urine?
Yes, doctor. It's a long problem, and I went for the checkup, but they said it's
Mhm.
normal, so I didn't go for checkup again. I wake up at times at night.
Okay, I'm so sorry to know about it. So, have you noticed that when you wake up at night multiple times at night for urination, right?
Yes,
So,
doctor.
your urine leaks when you are going to the washroom?
Yes, doctor. After coming from the washroom, it's dribbles.
Sorry to know about it. Okay. And tell me that what is your weight according to your height?
It is 32, but it's maybe reduced 2 to 3 kgs.
Right, right. Okay, so Mr. Allen, what is crossing over your mind?
Doctor, I feel this. I have bad reports, and I want something to make it better.
Right. Surely I will. I will definitely tell you about it. And which thing is worrying you the most?
यार मुझे बात नहीं आ रही.
Which thing is worrying you the most?
Doctor Sumera, just 1 minute. I stopped your timer. By the way, where were you?
Which thing is worrying you the most?
Doctor, I'm just worried that my heart might stop like my dad.
Yeah. Okay. I hope so not. Uh, and what are you expecting from me today? From this
Any tablets,
consultation?
doctor? Yeah, any tablets, or do I need to go to hospital?
Yeah, right. I understand your worries. And tell me that is this condition impacting your daily routine?
Yes, doctor. I just am worried about my heart health. I'm getting anxious these days.
Right, I can understand. And do you feel any low mood these days also? Please tell me.
No, doctor.
Okay. So let's summarize. You are saying, Mr. Allen, that for the last 10 years you are having high blood pressure. For that, you are taking tablet Ramipril and indopamide, thiazide diuretic, and you have come with a report of 5.8. You think your heart might stop like your dad, and you want me to give you some medications, right?
Yes, doctor.
So can I examine you?
Sure, doctor.
So, in the presence of complete privacy and chaperone, I would like to check first vitals, BP, pulse, temperature, and respiratory rate of the patient. Then I will check. I will ask the patient, could you please take off your shirt and lie down? And then I will auscultate all the heart areas. I will palpate. I will palpate first. Then I will auscultate out all the heart areas. Then I will check the JVP. I will also check the pedal edema of the patient, and at the end I would like to check I would like to do the digital rectal examination of the patient.
Okay.
Okay.
So, an examination vitally stable, but irregular borders of prostate on DRE.
Okay. So, Mr. Allen, on the basis of history and examination, I have two things in my mind. First of all, that your report is showing 5.8 of potassium. It is because of the ACE inhibitors you are taking. Okay. So basically, ACE inhibitors has few side effects. One of them is increase in potassium levels. Are you getting me?
Yes, doctor.
And do you have any dry cough also?
No, doctor.
Okay. So what we will do is that we will stop this ACE inhibitor and replace it with some other medication. How about that?
Okay, doctor.
Okay. And because 5.8 is very high levels. Second thing is that I would like to do your QRS calculation. The QRS basically is the tells me that what is the chances of your heart disease in the next 10 years. Okay. If it is high,
Okay,
then in that case I will give you atovastatin tablet, 20
okay, doctor.
milligrams.
Okay.
Okay. And you are saying that you have back pain. For that I will refer you to the gland doctor and urologist. We call it that doctor urologist. And because since you have enlarged gland urine which is in your urine area, so it might be possible that you are having some kind of enlargement of this gland. So the doctor will do some ultrasound and he will do some tests like a prostate specific antigen, CBC. Yes, okay, I will give you some test also, like I would like to do CBC and the prostate specific antigen, fasting lipid profile, fasting blood sugars, and your LFTs and ECG. Okay.
Okay, doctor. ECG
Okay.
normal.
Okay. So, Mr. Allen, please try to reduce your weight, eat healthy diet, and try to do 30 minutes walk daily. Can you do that?
Sure, doctor.
Meanwhile, I'm also giving you a proton pump inhibitor because you are taking brufen. It affects your tummy. So take this. And I am referring you to the gland doctor, prostate gland doctor. And come to me when you're,
Cancer.
sorry, time finished?
Yeah.
Oh,
To gland doctor in how long?
like 2 weeks time,
Okay.
urgent referral.
Okay.
Since he has lost weight also, and because of the irregular borders and back pain also. That is why.
Okay, we'll discuss about it. Your next patient is Mrs. Priya, 29 years old female, came to discuss her problem with you. Please proceed with history and management plan. Examination is gray. Your time starts now.
Hello, Mrs. Priya. My name is Dr. Sumera. Please tell me how can I help you today?
Doctor, actually, I'm really scared because my flatmate, he's got a TB, and I was living with her, and I don't know if I am infectious or if I got the TB also.
Okay, Mrs. Priya, I can understand your worries. So I want to ask you a few more things. Is it okay with you?
Sure, doctor.
Okay. So please tell me, do you have any cough right now?
No, doctor.
Any fever?
No, doctor.
Okay. So tell me that you're saying your flatmate has a TB. So is she taking medications?
Yes, doctor. They started on her on 4 medications for 4 months.
Okay. And when like you are still living with her?
No, doctor. As soon as I got to know her results were positive, so I got away from her. But now I'm really
Okay.
scared because she could have infected me.
Yeah, I can understand your worries. Okay, right, right. Your worries are right. So, now I want to ask you a few more things, and then I will suggest you. Please tell me that now where are you living?
I'm living in another apartment since 2 days now.
Since 2 days now, and tell me that since how many days you live with her? How many days you live with her? Yeah.
We were living like since 2 years now, and she was diagnosed 3 days ago.
So she was diagnosed with lung TB, right?
I don't know, doctor. It was on her neck.
It was on her neck. There was a lump and bump in her neck.
Yes, doctor.
Does she have any fever?
Yes, doctor.
Does she have any cough?
No, doctor.
Okay. So, Mrs. Priya, please tell me that do you have any long-standing illness?
No, not otherwise.
Are you taking any medications?
No, doctor.
In your family, does anyone has the lung problems
No, doctor.
or TB?
No, doctor.
Okay. So, do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
What do you do for your living?
I'm a student
You're a student. Okay. And since 2 days, you are saying you are living with it at your home
with my flatmate in other flat.
with your flatmate with other flat. Okay. And do you do any daily exercise?
I try, but doctor, my days are so occupied.
Right, right. What is the weight according to your height?
25.
Okay. So, what is crossing over your mind? Like you think yeah, that you got TB, right?
Yes, doctor. Yes.
And you are worrying about it.
Yes.
Okay. So, and you expecting me to do some tests for you, right?
Yes, doctor.
Right. So let's summarize, Mrs. Priya. And what is the date of your last menstrual period? Please tell me.
2 weeks ago.
Okay. So you are saying that you have a contact with the patient with a TB, and now you are worried because you might think that you have caught that, and you want me to give some to do some investigations. Okay. So Mrs. Priya, since you are saying that your friend has some lumps and bumps in the neck and she does not have any kind of lung symptoms, so it might be possible that she is having extra pulmonary TB, meaning the TB which is outside the lungs, outside the chest.
Okay.
So if she has this kind of TB, then this TB is not contagious. Okay, you cannot catch this kind of TB. But if she has cough and the chest symptoms, then it might be possible that you have caught it. So what I will do is that, for your satisfaction, I will do some test. Okay, I will do one IGRA test, and if it
Okay.
is positive, then I will do one chest X-ray of you. How about that?
Okay, doctor.
And meanwhile, also I will write some CBC, and that's it. So you can come with this test. I can, if you want, and I want to examine you quickly also.
Okay, doctor.
So I will quickly check the patient vitals. I will auscultate, I will check any lumps and bumps in the neck. I will auscultate all the lymph nodes, check the pedal edema. I will auscultate, quickly auscultate the chest of the patient from anterior, posterior, and side. Okay.
Okay, everything normal.
Okay, so Mrs. Priya, please come with these reports once when the labs will come. And I think the patient has extra pulmonary TB, so don't worry, you will not catch this kind of TB. Okay,
Okay.
and meanwhile, whenever you go out and contact, has she since how long she is taking the medications?
Which medication? She started
TB.
just now, like 3 days ago.
Okay, try to avoid going to her flat, and if you feel that you are having cough, you are having weight loss or any symptoms like fever, then in that case, please come to the emergency.
Okay, doctor.
Okay. Do you have any questions?
Doctor, actually, I visited a day before I was leaving from the flat. I visited my family also. Can I bring them so you can screen them also?
Yes, please do bring your family. Is there anyone, any pregnant lady in your family?
Mm, no, doctor.
Any child less than 5 years of age?
Yes, doctor, my brother is less than 5 years.
Okay, so in that case, bring your family also, and I will do your test. And then after that, if your test shows that you have TB, then in that case, we have to give preventive medication to the child also, 6 months. And if you have a pulmonary TB, then you will also get the 4 months, 4 months of medication. Okay,
Okay, doctor.
uh, yeah. Otherwise, no need.
Okay, doctor.
Okay. Okay, thank you for coming.
1.5 minutes remaining. Anything else?
Um, Anything else? No. Like the
Okay.
patient is a extra pulmonary TB, so like, what should I say about it?
Okay, it's okay. So let's talk about your both cases. First was the patient was hypertensive since 10 years and he was taking medications. You didn't ask since both medications he been taking since 10 years or just he started any new medication. So he started this new medication in dapamide 4 weeks ago.
Okay.
Okay. Because this might be the cause of his number one cause of hyperkalemia. Secondly, he was also taking on and off brufen.
Yeah.
So and there could be chance of chronic kidney disease since aged 65 years, and also we need to check his GFR on the labs, but it wasn't given. These two factors could be cause of high potassium. It's
Okay.
5.8, but the ECG is normal and patient is asymptomatic, so we will firstly reduce or just stop one of the diuretics, keeping in view about his uh, blood pressures. We can start alpha or beta blockers.
We
Okay,
will not
hyper
stop the ACE inhibitors.
both does the same thing, hyperkalemia. So you can either stop ACE or either stop thiazide.
Okay, okay,
But ACE
okay,
is
right.
mostly rhinoprotective, so keep the ACE and you can go with the thiazide. But both
Okay,
of them can be taken as the lowering dose or just stop it. Okay.
okay.
And avoid NSAIDs. This was one important thing we need to tell him, since you can offer paracetamol or any other painkillers, but not NSAIDs since it can damage kidneys. You have to tell the patient. And also reduce the high potassium diets. You can give him a leaflet, and also the reduction in salts, dietary habits, no junk
Oh
food, reduce the
yes.
salt. Okay.
Oh yes.
Meanwhile, recheck the patient's potassium within 3 to 7 days.
Recheck the
Potassium
pressure
and
in
zinc.
3 to 7 days. Acha, okay.
Yeah, yeah, after decreasing or stopping the thiazide. And also, the major important thing in this case was the backache of the patient. So, whatever the patient is taking medicine and pain in the old age, we need to rule out. So, he was having bone pain basically because of prostatic cancer. So, it's good you did DRE, but after DRE, within 48 hours, we cannot do PSA levels.
Oh yes.
So, he was
DRE. After
hmm,
that till how much time?
48 hours,
Yes, you're right.
at least two
I
days, okay?
forgot.
Yeah, so you are not going to do any prostate with labs, but yes, it's irregular borders, bone pain already, there is a metastasis. So directly you are referring in 2 weeks, giving both the safety netting for his hypertension and also the prostate. If he feels complete blockage of urine or he feels palpitation or dizziness, he should come back as soon as possible. This was more a
Okay.
case of counseling and management rather than examination. So, examination could be gray in this case. Otherwise, there's no symptoms. Patient is telling you no chest pain, no headaches, no urinary complaints, no frothy urine actually, but a little bit of examination DRE was important in this case. And you will tell the patient to give you a follow up once they get back from the specialist. Okay.
Dr.
And you
Okay.
were
Musarat,
Follow
this
saying
with.
ACE.
hyperkalemia is mostly due to ACE, not endopamine. Can you please
Either
recheck?
diuretics both can cause.
Mm, I think it is more pronounced due to ACE inhibitor. So I was also thinking to stop ramipril.
Doctor,
Can
anything can be stopped over here. Right now,
okay,
patients' potassium levels needs to be like below the almost the
not
normal. So even if you're doing ACE, it's not a blunder. Even if you're doing thiazide, so that's why I'm telling you any of this. But you have
any
to
of this.
address it.
Okay,
You cannot let him go at home with the two medications. Okay. Meanwhile,
okay,
dietary and most importantly, in this case, could be NSAID is one of the causes of chronic kidney disease, so might be possible damaging and causing the urine and electrolyte disturbance, urea and electrolytes. Okay, and Dr. Samara, you are taking the names of the medication like ACE inhibitors or PPIs. You should better say the word formula name like Ramipril or
Ramipril.
omeprazole.
Okay.
Okay, not the PPI, say omeprazole.
So,
Okay. Fine.
Dr. Masarat, I want to ask in old age, every patient with a backache, we need to rule out the prostatic cancer.
No,
No,
not every
no.
patient.
Okay. Is there
Depends
any
if,
clue with it that will
yeah,
go to? Okay.
yeah. There are sometimes osteoarthritis, there are sometimes back pain.
Yes,
So
yes.
just
That's
ask the
why I
patient.
was.
so, Dr.
Yeah, so
Musarat,
ask
in
the
this case,
patient.
should we mention to the patient that I am suspecting something serious because of the irregularity of the prostate?
No, no, no. You are not
No?
going to say anything regarding prostate, but yes, you will say, I need to send you urgently to the specialist because there's something that I don't feel normal, but you don't state name for it. If patient insists you, then you can explain, but don't use the word cancer. Okay, for suppose if he asks you like what abnormality, doctor, so you can say as you have urine problems, and as I checked you, just examined you, I feel there is some problem with your gland below the urine bag. So that's why for confirmation I'm sending you to the specialist, and once you get back from there we need to talk a lot about it because it's already in the bone. So definitely a prostatic cancer. Okay.
Okay, yeah.
So you have to treat a patient as a whole. That's why it's called a holistic approach. You cannot just ignore if he's having a backache. Sometimes in microcytic anemia, patients bring you the report and he's 45 and above, and he doesn't have any complaint at all. Just a change in frequency of the bowels. So that's cancer. That's why just don't keep an eye on one diagnosis. Take the patient as a whole. So that's why I brought this case over here.
One more thing
Okay.
is that if you are saying the examination is gray, then in exam, like we don't need to do the examination, na? We don't have to touch.
No, 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 no.
Okay.
No
Okay.
examination is no touching. Okay. That's definitely fine. But if there is gray examination, there could be a hidden clue. They want to
So
know
what?
that if
Mhm.
you are going to touch the patient, is there any need of touching the patient, or you will just give him medication? And like in this case, if you don't do DRE, you don't get he is having a prostate cancer, you are trying going to lose the case, right? So this is the mentality. Like if you have gray, just know I have to do something.
Okay, one more question. Like in exam, like if the examination is gray, what sentence will be written in the paper in the
Nothing.
examination? Sorry?
Nothing. There will be written
Nothing.
nothing. Hmm.
They will be
That's
written
why
nothing.
it's
Okay.
gray.
Okay.
Yeah.
And if it is examination, it should not be done, then they will clearly write that examination not required. And
Yeah.
when it is not written, then we have to say the examination, not the do na, only say.
Yeah.
What do you think?
You will say that I want to perform examination, and if they allow you, like the SP stands up and you ask him to come on the couch, but examiner
Yeah.
tells you the find that just verbalize it or just state it, because it didn't happen with us actually. So it depends on the case. Like if there might
Acha.
be possible if you say I want to examine, I want to see this, and the examiner tells you the finding if there is any. But if he stays quiet, it means the examination is normal.
Okay. So I will say that I want to do the examination. Please come to the couch. And if the examiner say no, no need to do, no need to come to the couch.
Maybe
Like,
they ask you like what you want to examine, then you will
ah,
say title,
okay.
okay,
Oh,
and then they
okay.
will give you the finding. For suppose in PID case there is was not written no examination, so we verbalized, and then we got what was on the speculum. Okay.
Okay. Okay. Right.
So your next case was of TB, pulmonary, not pulmonary, non extra pulmonary TB. You
Hmm.
forgot to ask the open question because presenting complaint was so in detail. You forgot to ask one question. Even the patient is telling you detail, ask him, is there anything in detail you want to tell me more?
Acha,
If
tell
he
me
says
more, मैं
yes,
भूल Yeah.
then yeah, ask open question once at least. In the beginning, if there is a contact who wants to be traced, ask if which TB your friend got. Here it was a twisted case. Why? Because patient was having extra pulmonary, and in that case, touching or getting exposed with the secretion of neck TB
Hmm.
or glands TB is the only way of spreading it. Otherwise, there is no need to. Okay. And secondly, the contacts of the contacts shouldn't be traced.
Hmm. Okay.
There is no need. So, no need to bring the 5-year-old kid or even the pregnant. And no need to do her chest x-ray since she is asymptomatic and she didn't have a contact directly. So this was one important question. Did you get directly into contact with her secretions or her skin? No, doctor. Then the only thing is here is reassurance.
Like
Okay.
in pulmonary TB, we have to context of contact should be traced, na? But in extra pulmonary, we need no need to trace, right?
In extrapulmonary, if the contact is made by direct skin touch or
Yeah,
secretion,
yeah,
yeah,
I got it.
then
Yeah.
you will follow IGRA. But in pulmonary TB, it depends. Okay.
Okay.
If the patient has symptoms, then the contacts will be screened. But if the doesn't have any symptoms, doesn't have any cough or sputum, then still it's not confirmed. Therefore, contacts doesn't need to be confirmed. It doesn't need to be screened. First, you will screen the contact, the patient right in front of you, and then if he comes as positive, then yes, you're going to screen the contacts of this one. Okay.
Yeah, yeah. Okay, right.
So
Right.
here you need to ask about her married life.
Secretions.
She wasn't married, but you can ask, "Are you married?" Could be
I
she is
remember.
possibly pregnant, but you asked the last menstrual period already.
Yeah, yeah, yeah.
And this was the only counseling case.
Dr.
No
Musarat?
need to run any. Yeah, no need to run any labs.
Okay, Dr. Musarat, as you told that if the patient contact has not diagnosed exactly and not start treatment, then only need to contact immediate contact we want to trace, not all other contact. Like this, no, you are saying. Please explain this.
Uh, Dr. Asba is there, na, right? Okay.
Yes,
I'm
yes.
saying that for suppose someone having cough and they are coming to you having cough and fever and night sweats, and they are contacted by someone who already diagnosed as TB or they traveled, and all the symptoms of the patient in front of you is TB. Then you are going to trace the contacts. Okay, in
Okay,
that case.
okay,
But
okay.
if the patient just came telling you, doctor, my friend diagnosed as a TB and now I'm scared, but he doesn't have any cough, any chest complaint, any fever, any night sweat. So, in this case, firstly, you are going to screen this patient. Okay. If he comes positive, then you are going to screen his contacts. If he
Okay,
comes negative, then you are not going to screen his contacts. Okay.
okay, okay, understood. Thank you.
Okay. You're welcome. So, these were two cases. But it included many more topics. So next, Dr. Kamlesh, are you there?
Yes, yes.
And I guess Dr. Sabah did not join us, so there are two cases for you. A patient,
Mhm.
Mrs. Karen, 38 years old female, came to discuss her problem with you. Please proceed with history and management plan. Examination is not required.
Okay, sure.
And your time starts now.
Good day, Mrs. Karen. My name is Dr. Kumar. How may I help you today?
Doctor, I went for these lab reports and I
Mhm.
wanted to know if these are normal.
Well, I'm here to help you out. So, can you show me the test?
Yes, doctor. ALT is 110, AST is 95. High.
And is ALT is one.
ALT is 110.
Okay, AST is 90. Okay.
Yeah.
So, Mrs. Karen, before proceeding, can you just tell me why you did this test?
Doctor, I don't know. I just was feeling my right side of pain in my tummy.
Okay. Mm-hmm. Is there anything else to say?
Yes, doctor, only this. And actually, I don't know why I am having this condition. I just feel fatigue most of the
Mm-hmm.
times.
Mm-hmm. And is it okay to understand better about your condition if I ask you a few questions?
Sure, doctor.
Okay, so you told that you have pain in right side of tummy and fatigue. So can you tell me since when?
It's been going on since now few weeks, like
Mm-hmm.
5 weeks now.
5 weeks. Okay, and have you noticed that? Sorry, can you show me exactly where the pain you feel?
Right upper quadrant.
Mm-hmm. Okay, and right upper quadrants. And have you noticed any change in your skin since?
No, doctor.
Have you noticed you have to throw up?
No, doctor.
Okay, and apart from this, have you noticed any night sleeping problem?
Uh, no, doctor.
Okay, and okay, and sorry. So, have you noticed that this all comes suddenly or gradually?
Doctor, sometimes it comes and goes on its own.
Mm-hmm. Okay, have you noticed sometimes there's pain in that area is increasing with some specific conditions?
Doctor, sometimes I take antibiotics. I feel that
Mm-hmm.
right side is heavy.
Okay, and have you noticed something is making it better?
Mm, no, doctor, nothing makes it better. Mostly, when I'm drinking a lot of water or lemon juice, I
Mm-hmm.
feel it's better, but it's still there.
Have you noticed any change in color of your eye?
No, doctor.
Urine,
No, doctor.
stool?
No, doctor.
Are you feeling that you are tired all the time nowadays?
Yes, doctor, I feel fatigued.
Okay, have you noticed that this pain goes sometimes in the shoulder area?
No, doctor.
Have you noticed any change in your weight?
No, doctor.
Any swelling or watery feeling in your tummy?
No, doctor.
Have you ever suffered from high sugar levels,
No, doctor.
high blood pressure,
No, doctor.
any liver problem?
No, doctor.
Okay, are you using any type of medication for over-the-counter or regular basis?
Yes, doctor, I sometimes have this oral thrush and I take this
Mm-hmm.
medication. They call it antifungal. So I'm taking it
Antifungal.
on and
Okay.
off. Yes, for weeks.
Okay, and any of your family member has suffered from high sugar levels?
No, doctor.
Any liver problem?
No, doctor.
Okay, and when was your last menstrual period?
Uh, 2 weeks ago.
Okay, and are they regular?
Yes, doctor.
Okay, and do you drink alcohol?
Yes, doctor, a lot.
A lot. Around how much?
2 to 3 glasses every evening.
Okay, and since how long?
It's been 20 years now. Not 20, sorry, 13 years.
Mm-hmm.
13.
Okay, how about your food habits?
Doctor, I'm food lover and I'm going every night outside getting junk and
Mm-hmm.
frizzy drinks, cold drinks.
Mm-hmm. Mm-hmm. And do you have any idea about your height and weight?
33 BMI.
Okay, and what do you do for a living, Scare?
Doctor, I am owning a cafe.
Okay, and how are things at home and at work?
Everything is good.
And with whom do you live?
I live with my husband and one kid.
Mm. Okay, very nice to hear about that. So, Miss Karen, do you have any idea what's in this result like?
No, doctor, I just don't know why my liver,
Mhm.
these tests are
Mhm.
abnormal.
Only this test, let's get a little more. And is there any specific concerns come in your mind?
Doctor, I don't want cancer or any virus for my liver.
Don't worry about. We will discuss about this. Okay, and what you are expecting from in today's life, today's consultation? I mean.
Doctor, I just want some medications to get myself
Mhm.
better.
We will see. And apart from this, how you feel that it is impacting on your regular life?
Doctor, actually, this thrush coming and going again and again. I'm taking those
Mhm.
medications also. Now my liver is infected. I'm anxious about my health now.
Sure. So, Miss Karen, you told me that you have this tired feeling and this uh, your results is little on the higher side for your liver enzymes, and you are worried about it can increase some problem or make can for you some problem, and you are expecting me to discuss exactly what the problem is, right?
Yes, doctor.
Okay, so regarding this condition, how about if I offer you to do for you your examination, and this examination will be done in the presence of the chaperone and total privacy. Is it okay?
Sure, doctor.
Okay, and this, sorry to, I forget to say you, for this examination, you may have to up your shirt up to the navel of upper abdomen. Is it okay?
Okay, doctor.
Okay, so after having this, I will check your general physical examination, examination of your palm of hand, stresses, the movements of your hand, jerky movements of your hand, as well as I will check the pressure in your both arms, your pulse in your both arms, your eyes, lymph nodes in your neck. I will also have a look at your tummy, have to touch it, have to tape it, and to listen the sounds. Okay, and I will check during this. I will have to look at your face. I will check mostly like for your. My concern will be regarding your liver and spleen areas. Okay, I will touch it as well. So, is there anything?
No, nothing. No
Okay,
finding.
so you have come this. How about if I write for you some more tests for is it okay with you to see
Sure,
the other
doctor.
things which I am suspecting like lipid profile, your HbA1c. Okay. And after having this, all that your ALT is more than your means your liver enzymes are more than it most probably looks like you are suffering from a condition we call it fatty liver. Do you know about it?
No, doctor.
Actually, this is a condition in which there is extra fat buildup in your liver. Okay, it is
Time's
very
up.
common and often happens due to the increased weight. Okay, the increased cholesterol level. I have already written for you some lipid profile. We will see about the results, and we will see. And the good news is that it can be reversed with the
Okay,
lifestyle
doctor.
changes, like to lose your weight, to having some healthy eating, to do the exercise on the regular basis, avoid the junk food, take the healthy food containing vegetable proteins and less fat. Are you getting me?
Okay, doctor.
Okay, and even sometimes this alcohol, as you are taking an excessive level of alcohol, it also sometimes making this condition little worse. Are you getting me?
Okay, doctor.
Okay, so I will suggest you if you can do a taper down the alcohol use and to cut down by doing it for a longer time. Okay, and if you will do
Okay.
exercise and you lose your weight for 7 to 10%, it will also make your condition more improved. Okay,
Okay, time's up, Dr. Kamlesh. 10 minutes
okay,
over.
okay. So
Okay.
just I want to tell, I will refer you to the specialist to do the scan of your liver. Okay, and that's it. If you have
Okay.
any abdominal pain, distension, bleeding, you can come back to me.
Okay, doctor. So
Mhm.
your next case is just give me a minute. Your patient is Mr. Ben, 34 years old male, came to discuss his problem with you. Please proceed with history and management plan. Examination is gray. Your time starts now.
Sorry, actually, I was disconnected. Just can you repeat, doctor, please?
Yeah, Mr. Ben, 34
Okay,
years old male. And
okay,
history and management plan examination is gray. Okay. Time
Oh,
starts now.
okay. Good day, Mr. Ben. My name is Dr. Kumar. What brings you here today?
Doctor, I have got a sharp pain on my left side.
I'm sorry to hear about your pain. Can you tell me something more?
Doctor, it's so I cannot bear the pain sometimes, and it's on the left side of my chest. Especially,
Mm-hmm.
doctor, I'm really worried it could be a heart attack.
We can understand your concern, and I'm here to help you out. So, can you just, is it okay if I ask you a few questions?
Sure, doctor.
Okay, first of all, Mr. Ben, I think you looks in more pain. Are you comfortable in sitting? If you can come on the couch if you are not easy over here.
No, doctor, I'm comfortable sitting.
Okay, so you told me this pain. So exactly, can you show me where exactly is the pain on the left side?
On the left parasternal.
Parasternal. And when this start?
Doctor, it started suddenly
Mm-hmm.
in the morning,
Okay.
and doctor, I feel like it's a heart attack.
Okay. And since the start of this pain, are you feeling it is the same? It has increased in the severity?
It's staying the same, but it's really sharp.
Okay. And is this pain, if I ask you what type of pain is it, how will you describe it?
Sharp pain, doctor.
Sharp pain. And let's suppose 1 is the minimum and 10 is the maximum severity. How will you describe?
Doctor, 7 to 8.
7 to 8. Uh-huh. Okay. Is this pain going somewhere else?
No, doctor.
Okay. Have you noticed any sweating?
No, doctor.
Have you uh, have you ever encountered the same pain in the past?
No, doctor.
Okay. When it started in the morning, what you was doing exactly?
Doctor, I was holding this heavy box.
Uh-huh. Have you noticed that if you take deep breath, this pain is increasing?
Yes, doctor.
Uh-huh. Okay. And apart from this, have you felt any difficulty in breathing?
No, doctor.
Okay. And are you feeling okay? Or if how about if I offer you some injection to relieve your pain first?
Yes, doctor. Please give me some injection.
Okay. Do you have any type of allergy to any medication before?
No, doctor.
Okay. So I will tell my nurse to give you the injection diclofenac. Mhm. Okay. So have you noticed any throw up?
No, doctor.
Okay. And do you feel any cough?
No, doctor. But it's really painful when take deep breaths.
Take the breaths. Okay. And have you ever felt that you have chest discomfort on walking?
Yes, doctor. When I'm moving, that I feel discomfort.
Mhm. Okay. Have you any rash on your body in your chest area?
No, doctor.
Okay. Have you ever suffered from high blood pressure,
No, doctor.
high sugar levels,
No, doctor.
high lipids?
No, doctor.
Okay. Any of your family member has suffered from heart problem?
No, doctor.
Okay. And do you use any type of medication on a regular or over-the-counter basis?
No, doctor.
Okay. And what do you do for a living, Mr. Ben?
I work as a teacher.
Work as a teacher. Uh-huh. Okay. Do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
How about your eating habits?
I try to stay out away from junk, mostly
Mm-hmm.
taking balanced diet.
Okay. And with whom do you live at home?
I live with my wife and one kid.
Mm-hmm. And you told that you encounter this pain when you are uh, pulling the heavy mat. What do you do for a living?
Doctor, I work as a teacher. It's just a heavy box at
Yeah,
home and I was lifting. Yeah.
at home. Okay. So, what comes in your mind regarding your pain, Mr. Ben?
Doctor, I feel it's a heart problem.
I can understand your concern. And is there any specific concern apart from that one that it is a heart problem?
No, doctor, only this. I just don't want to
Okay.
die this young.
Okay. What you are expecting from me apart from to relieve this pain?
Doctor, I want to go to specialist for my heart checkup.
Sure, I am here to help you out. So you told me that you have pain since morning, and when you was pulling a heavy weight at home, okay, and you are worried about it can be some heart problem, and you want me to send you to the specialist, right?
Yes, doctor.
Okay, how about if I do for you your general physical examination as well as examination of your heart area?
Okay, doctor.
So for that one, I will, in the presence of the chaperone, after having uh, sanitize my hand, I will do your checkup. For this, you have to come on the couch, and during the examination, you will have to remove your shirt up to the nipple level. Is it okay with you?
Okay, doctor.
Okay, I will check your vitals. I will check your blood pressure in both arms. Apart from this, I will have a look at your chest to see the movements of your chest, any deformity, anything. I will check your oxygen level. And apart from this, I will touch your area. During the touch, if you feel any pain, you can stop me anytime. Is it okay?
Okay, doctor.
Okay, so anything on touching the area?
Yes, localized tenderness on third and fourth
Mm-hmm.
joints.
Third and fourth joints. So, okay, so after having this all, and I will have to I will have to listen the heart sounds. Okay. So most probably, Mr. Ben, after having this all things in consideration, mostly it is looking like, but just to be on the sure, on the safety side, I just want to do for you your heart tracing. Is it okay?
Okay, doctor.
Okay, and after this, I will check, and also I will advise for you the X-ray. Maybe sometimes there is a local tenderness because of some hit in the chest area, there's some pressure in the chest area or the bones of the chest. Are you getting me?
Okay, doctor.
So anything in the heart tracing or the X-ray?
Everything fine.
Okay. So after having this all things in consideration, Mr. Ben, it seems like that you have suffered from a condition we called it muscle pain. Are you getting me?
Okay, doctor. What is it?
Actually, when you try to pull this heavy weight, so because of that, sometimes your muscles are getting sprained, are getting some strain on them. That's why you are feeling this pain. Okay. And I will keep you over here for next 30 minutes to 1 hour. So check after this injection how it is working for you and how this is relieving your pain. Are you getting me?
Yes, doctor.
Okay. And after having this everything in good, so then I will suggest you in the future try to avoid to get heavy weights. Okay. Or to pull or push the heavy weights.
Okay, doctor.
Okay. And if it is relieving, it's okay. Otherwise, okay. And if this pain is getting better, I will write for you some medications to take it at home. We call it the NSAIDs. Okay.
Okay, doctor.
And because you don't have any problem with your stomach, so you can take it easily.
Okay, doctor. Time's up.
Okay. Okay. I can see you after 1 week. If you have any pain, you can come to me anytime.
Okay, doctor.
Hmm.
Okay, Dr. Kamlesh. So your first case was, what
Petty.
do you think your first case was?
It was fatty liver.
Okay. Actually, patient was having a recurrent thrush,
Mm-hmm.
so oral candidiasis, and
Because
she was
oral candidias
taking,
and antifungals.
yeah, she was taking
Mhm.
antifungals
Yes,
every
yes,
few
yes.
weeks. And this
Mhm.
time she went for the LFTs and it was a bit deranged. So here the cause. of LFTs were,
Antifungals.
yeah, antifungals.
Mm-hmm.
Okay. In fatty
Mm-hmm.
liver, if you're keeping it as a differential, it's okay because the BMI was high, her dietary habits were bad, and also we can run hyper
Mm-hmm.
these cholesterols. Okay, lipid
Yes.
cholesterol
Yeah, I
and
told you
lipid
I will
profile.
get for your cholesterol levels. Yes.
Yeah, and I guess there was no examination required in this case, but you did anyway.
Mm-hmm.
So when there is no
Yes.
examination required on the lab reports, so you
Mm-hmm.
just keep on asking for the history, and then you can
Mm-hmm.
come on the management plan. Okay.
Oh. Mm.
So important thing over here was she went
Antifungal.
for these lab results, and she
Mm-hmm.
was having a bit pain, but no other signs of jaundice or viral
Mm-hmm.
hepatitis.
Yes.
So one cause could be the alcohol causing the fatty
Yes.
liver, and the other major cause was here fluconazole. She was taking 150
Mm-hmm.
milligram capsule for so long. Another factor here, we need to know that why is she getting thrush again and again. So her dietary habits were bad, her BMI was bad, so could be
Oral
insulin
hygiene.
resistance, and yeah,
Mhm.
we need to check her diabetes levels. Could be
Yes, I told
pre-diabetic or
HbA1c and
diabetic.
lipid profile. Yes.
Yes. So investigation, you rightly did LFTs for you did viral hepatitis and lipid profile,
Lipid
and
profile
also
and HbA1c.
yeah, we also need to do ultrasound
Mm-hmm.
and viral
For
hepatitis
ultrasound, I
panel.
told her I will send you to do the scan of your tummy.
Yes, yes. And furthermore, you will repeat these tests in short term after stopping the medication,
Medicines. Yes.
fluconazole. And also
Mm-hmm.
one important thing was HIV testing.
HIV.
recurrent
Mm-hmm.
recurrent infections.
Mm-hmm.
Here HIV testing can be done. Okay. And
Doctor,
also if you stop the fluconazole, then what we are going to give the medication actually, what you can give the medication over here.
The
Nystatin,
alternate
oral
one.
suspension.
Yes,
Nystatin.
clotrimazole for suppose for oral
Mm-hmm.
thrush, or topical azole will be given.
Nystatin drops, I think we are giving here, but I'm not sure about exactly.
Nystatin is also antifungal. Clotrimazole gel is also
Mm-hmm.
antifungal. So it depends whatever you, but switch it to the topical.
Okay.
And also address her alcohol intake. She's taking a
Mhm.
lot, and tell her that it could be
Yeah,
the
I
cause
told
of
her to,
diabetes.
reduce it,
Yeah.
and if possible for you, if you can
And
by
safety
reducing.
netting.
Mhm. If any abdominal pain, any color change, any eye change, eye color change,
Yes.
any problem like that,
Yes.
tummy
And
pain.
recheck LFTs in 4 to 6 weeks after stopping the
Yes,
medication. Okay.
yes.
Yes, Dr.
Mhm.
Azba, you were asking something?
I'm asking that if we say only get, I will do your check your viral serology, then cover it HIV also, or we will need to
Yes.
separately. We can say that we will check your viral serology. It will cover all HIV, hepatitis B, C, all. So we
Yes,
can.
it will cover all of it.
Oh,
Okay. Okay, doctors. The next case was, which was the next case? Let me bring it up.
Muscle spasm. Okay.
Costochondritis, chest wall pain.
Yes.
Okay.
Mhm.
It was, in particular, we can say costochondritis.
Okay.
Mostly the patient will be thinking here the concern was of the patient was having heart problem or something like that, but
Mhm.
actually it wasn't. It was just a costochondritis or chest wall
Mhm.
pain, no shortness of breath, no other red flag sign,
And movement
just a
increase.
muscle strain, or you can say it costochondritis. If he
Mhm.
has shortness of breath, could be pneumonia or pulmonary embolism.
Mhm.
Okay, and cardiac pain, as there is no radiation, there is no
No
pain on
radiation, no
ankles.
unwalking, nothing.
Yeah,
No radiation.
no sweating.
No
Then
sweating, no nausea,
no,
vomiting.
yeah. So it could be less likely it is a cardiac pain, and no family history of any young deaths or sudden
Mhm.
deaths.
So
So
I
this is
think we
least
should
likely.
can give only this diclofenac and
Yeah, you
like
did it right. You did it right. I'm
Mhm.
just highlighting the points that
Yeah,
everyone
sure.
needs to
Thank you.
know.
Thank you.
So vitals and CVS and respiratory examination, even if it's gray, then still you have to do. Okay,
Mhm.
because on palpation you will see there is
Yeah,
pain
yes.
on.
Touching the pen.
Yeah, and investigation you're going to do no investigation, but still if you feel doubt, since
Mhm.
in how in the if the patient is diabetic, mostly the pain mimics as upper GI discomfort. So in that case, in a diabetic patient, any upper GI discomfort, you will run the ECG.
Yeah.
Okay. So
Mhm.
how do you manage the patient? Non-pharma and pharma again. Just non-pharma is reassured. He doesn't need to go to the specialist. It's a just normal chest wall inflammation, or you can say irritation. It's not a heart
Mhm.
attack. And you will give the medication as you said, and it says short course with the food if no
Mhm.
contraindication, or you can also give paracetamol or topical NSAIDs. Sometimes patient is telling I have heartburn, so don't give the oral NSAIDs, give the topical NSAIDs with the paracetamol. And if he insists on going to the specialist, then tell him it's right now, as you feel that you are getting better with the injection I just gave you, so most
Mhm.
probably this is just chest wall pain, but in case you feel short of breath, chest pain, other than this, and you feel sweaty or dizzy, then please present to emergency as soon as possible.
Pen
Safety netting
radiation.
is must in case, yeah, pain radiation. Okay, doctor.
I think
So
I
this
tried
was
my best, but I'm not sure how it went. Like,
no. Your history taking is good. You run the like up to mark.
mhm.
Investigations and management plan was fine,
So I have to tell the
but
costochondritis and because of the muscles and sprain of the
even if you're
muscles.
saying muscle spasm, it's fine.
Mhm.
Muscle spasm, muscle
Yeah, because
strain,
I told them you'll get a
costochondritis.
sprain of your muscle and avoid this in the future.
Yes. Okay. So, is there any other query? Okay, doctors, today these cases were twisted just because to take you from every corner. Like in every case, we didn't go straight forward for one case. There were many things that you need to know. And if the patient is telling you there is back pain or he's on some medication and taking any painkillers, take it seriously. Okay?
Yes. Thank you.
Okay, doctors. Thank you, everyone. Dr.
Thank you
Sabah,
for your
are you
time.
there? I guess she's busy, so we'll stop our session over here. Thank you, doctors.
Yeah, thank you.
Thank you.
Thank you.